Latoya?
Yes.
Hi, my name's Regina. I'm a nurse here at the clinic, and I'm going to help go over some things regarding your recent diagnosis, okay? First of all, is English your primary language?
Yes, it is.
Okay, good. Well, I know what we're about to talk about may be an uncomfortable topic, but I just want to let you know that this is a no judgment zone here, okay? I just want to help educate you and provide you with some information. So as Dr. Williams just shared with you, you have been diagnosed with a sexually transmitted disease, or STD, known as gonorrhea. And gonorrhea is caused by infection with the Neisseria gonorrhea bacterium that infects the mucous membranes of the reproductive tract, including the cervix, the uterus, fallopian tubes, and urethra in women. Urethra is where you pee. It sometimes can also infect the mucous membranes of the mouth, throat, eyes, and even the rectum. It is important to note that gonorrhea is caused by bacteria, and so some form of antibiotic needs to treat it. It's not like you can take some kind of natural remedy or home herbal remedy or something you heard from someone that might work in treating it. It has to be treated with medication, antibiotic medication of some sort to treat it, okay? So it's a good thing that you're here so that we can try to treat it. Gonorrhea is a very common infectious disease, and it's most prevalent in young men and women like yourself between the ages of 15 and 24. Our government actually has an initiative called Healthy People 2020, and one of the goals is to help reduce the high incidence rates of STDs, including gonorrhea, by promoting healthy sexual behaviors, such as wearing condoms or limiting sexual partners, things of that nature. So gonorrhea is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. And ejaculation does not have to occur for gonorrhea to be transmitted or acquired. A lot of people don't realize that. So any sexually active person can be infected with gonorrhea. Nobody's immune or not susceptible to getting it. But something for you to be aware of is that African Americans like yourself unfortunately tend to have higher incident rates of gonorrhea specifically. So it's really important that we all help educate each other and spread the word about this, especially since this is an infection that is 100% preventable, okay? Any questions so far?
No.
No? Okay. I know the reason you first came to us was because you were having some pain when you peed or urinated, and you thought you might just have a urinary tract infection. And you're actually rare in that most women and men with gonorrhea are asymptomatic, or they don't have any symptoms at all. And what's scary about that is untreated gonorrhea can cause some serious and permanent health problems. In women specifically, gonorrhea can lead to pelvic inflammatory disease, which can sometimes damage the fallopian tubes enough to cause infertility or the risk of ectopic pregnancy. In other words, you might not be able to have kids down the line, or you might have complicated pregnancies down the line because of having stuff like gonorrhea, if it's untreated. Untreated gonorrhea can also increase a person's risk of acquiring or transmitting HIV, the virus that causes AIDS, which is fatal. So we're talking about some pretty serious stuff here, okay? I'm not trying to scare you, but I just want to educate you on it so that you're more informed and can maybe share this with your friends and family, or maybe not friends, but your friends. The good news is gonorrhea can be cured with the right treatment. However, the bad news is so many strains of gonorrhea have developed resistance to the antibiotics that we've been using to treat it. And so we've been coming up with different antibiotics to treat it over the years, but it's kind of getting to the point where the gonorrhea strains are evolving so that the medicines we've been using to treat it suddenly aren't effective anymore. And these newer aggressive types of gonorrhea are starting to be referred to as super gonorrhea, which makes it sound even more scarier because it is. So in your case, we are going to attempt to treat it with a combination therapy using 2 antimicrobials with different mechanisms of action. There's a cephalosporin called ceftriaxone, plus the antibiotic azithromycin. and to help improve the chances of the effectiveness of the treatment, okay? The ceftriaxone will give as a single dose injection here in the clinic, and right after that, I'll have you take the azithromycin pill orally or by your mouth. So you'll get a shot of one antibiotic and you'll take a pill for the other. We'll do it here in the clinic right after I'm done talking with you, and that's it for now. We do recommend that you abstain or not have any sexual activity for 7 days after today, after your treatment. And all sex partners should be adequately treated as well. Otherwise, you could wind up getting infected again. So I know it may seem awkward, but you do need to approach any sex partners you've had in the past 3 months, okay? Not only could you be reinfected, but if they are sleeping with other people, they're spreading the gonorrhea onto them as well, and then this problem's just going to keep getting worse and worse, okay? Also, and this is important, we would like you to come back in 3 months from now for us to retest, since evidence has shown that repeat infections are common for gonorrhea. So it's best practice to retest after 3 months just to be sure you are free of infection, okay? We also want to ensure you don't have a strain of gonorrhea that is resistant to the antibiotics that we're giving you today. Because again, it's very common to not have symptoms with STDs, so even if you think you don't still have it, you actually might, okay? Is it okay if we email and or text you a reminder closer to the time you need to come back to retest in 3 months?
No, sure.
That's okay? Okay, great. I see we do have your phone number and email address here on file, so we'll go ahead and contact you in 3 months after today. And in your instance, your health insurance covered most of the cost of the STD testing we did and the treatment medications, and you just had a low copay to pay. In the future, though, if you need STD testing or treatment done and are having financial difficulties, I wanted to provide you with some contact information for the City of San Antonio's health clinic that provides these services at very low cost, and they do make special arrangements in certain instances, okay? Here's the brochure. Go ahead and leave that with you. And I'll email you this information too, so you can share it with your friends as well, okay? And I also, I also have this fact sheet and that you can take home, and it kind of goes over everything that we've talked about today as well. And it also has some additional information about ways to prevent getting STDs, again, such as always wearing condoms and knowing how to apply them properly. I know that sounds silly, but believe it or not, some people think they're using condoms the right way or using them effectively, and they're not. So, do you have any questions about anything we've gone over so far, or is there anything else you'd like to ask or talk about?
No.
You sure? Okay.
It's clear.
Okay. Well, if you do have any questions once you leave, please do not hesitate to email or call back here, okay? Our contact information is at the bottom of the fact sheet that I just gave you. And again, we're here to help you and are happy to help however we can, okay? There's a lot of helpful information that you can read about on our website as well, and our web address is on that sheet as well. All right, I'm going to go get those antibiotics for you right now, and I'll be right back, okay?
All right.
Okay.